In this video, let us see about decontamination of the poison by using gastric lavage technique. In the previous video, I have discussed about the gastric lavage technique, what are the indications, and also we came up with the precaution to be taken while using this gastric lavage technique, and also we came across with contraindications of this gastric lavage. Let us continue the discussion with the procedure. Now, before using this gastric lavage technique with the patient, it is essential to explain the procedure to the patient, and it's also required to take his consent. Actually, in the hospital, the procedure will be explained to him in detail, and the consent sheet will be given. In the sheet, he will be signing after accepting the procedure which is going to happen with him. Suppose in case the patient, if he denied, if he refuse the procedure, it's better not to undertake lavage, because it may cause a lot of damage. Suppose the cooperation of the patient is not there, so it increases the risk of complication due to some active non-cooperation. And also the second aspect should be considered in the procedure, that is the endotracheal intubation. So this endotracheal intubation is a medical procedure in which a tube is placed into the windpipe, that is the trachea, through the mouth or nose. So in most emergency situations, it is placed through the mouth itself. So it is done to keep the airway open in order to give oxygen or medicine, or sometimes anesthesia is required, it can be given. So it will aid us in supportive breathing technique. So with the picture you can see the endotracheal intubation. With the help of this, the breathing will be very much easier. So this is very much fundamental with the comatose patient, because the breathing is not under control. With such technique, it should be used. And place the patient head down on his left lateral side, around 20-degree tilt on the table. While placing him towards this position will help in ease circulation. And also while inserting the pipe of this gastric lavage, so in the next slide I will be showing you about the picture and the construction or the structure of this gastric lavage equipment. So a tube will be used to pass into the stomach. So it's better to mark the length of the tube where you are going to insert that point. That is for adult means 50 centimeter we can mark, and for child means around 25 centimeter it can be marked, and up to that mark it can be inserted very easily. So now the ideal tube for this lavage is the lavacator. So this lavacator tube, with the help of this nasogastric suction, we can remove the toxic substances from the stomach. So these lavacator are made up of very clear or some gastric host substance. So in India, we will be using a tube which is called as EVAD tube. It's most oftenly used, which is a soft rubber tube with a funnel on the one end. We can observe this, a soft tube and a funnel which is used for passing the liquid. Gastric lavage fluid can be passed, and other end it will be get inserted. So here you can see the marking. Up to that we have marked, and it can be passed out. So then coming with the size, what is the standard size which can be used? Now whatever the tube you are using, but you should make sure the inner diameter. Now the length we have discussed in the previous slide. So now inner diameter, how much it should have. So that represents around 36 to 40 French size. Now this French size, if you convert, so each French size is equal to 0.3 millimeter. So this is the inner diameter the pipe should have. This is the structure of Ewald tube, which is widely used in the India. Then coming with the nasogastric tube, so a lot of complications are observed here. Orally what you are passing, that is more convenient than the nasogastric tube, because here gastric aspiration can also be observed. That's why inadequate and should never be used. Better to go with the oral. So coming with the children, the diameter inner circumference, it should be 22 to 28 French. So here one more tube which is called as Riley tube, which can be used in the children for the same purpose. Then what are the other precautions should be taken? Now we came across the structure of the pipe, which will be used for the suction of the substance which are present in the stomach. Now coming with the other precautionary condition, the preferred route of insertion is the oral route, because passing the tube nasally can cause damage the nasal mucosa considerably, and it can lead to severe epistaxis. Nothing but it will lead to bleeding of the nose. That's why it should not be tried. Orally is the preferred. Then while inserting the tube, it is better to lubricate the inserting end of the tube. We can use either Vaseline or glycerin, and it can be passed into the desired extent up to the mark what you have done. And also as a precautionary measure, it's better to use mouth gag, so that the patient will not bite on the tube, so that we can prevent the damage to the pipe also. Once the tube has been inserted, its position should be checked. Now whether properly the tube have reached the desired site or not, it should be get confirmed by performing a small test, like we can pass the air while listening on the stomach. This may be the one, air insufflation test. Or one more thing what you can make in this sense, aspiration can be taken from the tube, little sample. Then you have to check the pH, as you are well known that if it have reached the stomach, the gastric content should have the acidic pH. If it is properly positioned, so then we will be getting the substance of acidic pH, so that we can check the position of the tube where it have reached. So then coming to the procedure now, how you will use this lavage technique. So this lavage is carried out using small occludes. Occludes represents a small quantity of the fluids you are going to use. Now coming with the adult 200 to 300 ml occlude of warm 38 degree, especially saline you are going to use, or sometimes plain water can also be used only with the adult. In children, 10 to 15 ml per kg body weight of warm saline is used each time. This is a difference you can come across. With a child with using saline, with the adult there is an option for using both saline or plain water. Water should not preferably used with the younger children, because of the risk of inducing hyponatremia and your water intoxication. Hyponatremia means decrease in the sodium level can also be observed. That's why with the children it's better to use saline. It is advisable to hold back the first acolyte of the washing for chemical analysis. The sample what you got the first time while washing the stomach, that sample should be stored. So this will serve as a identification source of the chemical which got ingested. That's the first sample, it's always essential to store. So then this lavage should be continued until no further particulate matter is seen and afferent solution is very much clear. Once a clear solution if you get, then you can stop the lavage. Once you stop this lavage technique by confirmation, then immediately what you can make in the sense, at the end of the lavage, you can pour a slurry of activated charcoal in water, that 1 gram per kg, and an appropriate dose of ionic cathartic into a stomach, and then you can remove the tube. Now here two things you have included now. A slurry of activated charcoal you have passed, so they will act as an adsorbent. In the coming slide I will be talking in detail about activated charcoal. The mechanism is adsorption, where it prevents the absorption of further remaining quantity of the substances. Or we will be using some cathartic agents also. So this cathartics has a stronger effect and can cause evacuation of the entire colon, usually in the form of water or unformed stools. So it will be get removed out, so that like complete removal of the poison can be achieved by using the combination of these things. In certain specific type of poisoning, like a special solution may be used in place of water or saline in the gastric lavage. It's a gastric lavage solution. So most poison, like even known or unknown, we can use water or saline, but water is contraindicated with the children. Some example like oxidized poison, like alkaloids or salicylate, so which can undergo oxidation reaction. So in such condition, it's better to use potassium permanganate. So 1:5,000 or 1:10,000 ratio it can be used. This oxidation reaction can easily get analyzed by potassium permanganate. The change in the color can be observed because of the oxidation by this alkaloidal substance. As you know, the color of potassium permanganate, it is violet or purplish pink color. So upon oxidation, so this color will change to the buff color. How long the chemical substance retained in the stomach, up to that whatever the potassium permanganate for washing you are sending, so that will be having color change because of oxidation reaction. Once you are getting the same purplish color of potassium permanganate in the lavage procedure, so then it confirms like completely you are removed the alkaloids which are present in the stomach. Then for cyanides, we will be using sodium thiosulfate 25%, and for oxalates, calcium gluconate can be used as a gastric lavage solution. Then coming with the complication of this gastric lavage technique, aspiration pneumonia is a major complication. Laryngospasm can also be observed. Even sinus bradycardia and ST elevation on the ECGs can be observed. Very rarely some perforation or stomach bleeding or sometimes like esophageal damage can also be observed in only rare condition. This is all about the gastric lavage technique which is employed in the decontamination, whereby using some gastric lavage fluids, the unabsorbed poisons will be removed, but precautions should be taken, and whenever required, only during that condition gastric lavage technique should be used. And it is better to use this technique within 2 hours of ingestion of the poison, and also it depends on the nature of the poison. Once the poison got absorbed into the bloodstream, so then this gastric lavage technique may not be helpful, but if you are using after 2 hours, so that further absorption can be stopped by using this technique. Further in the next video, I will be uploading about the other techniques, that is the catharsis technique. Because of using this technique also, we can remove the poison